Whether your back is out of whack or your neck is in need of repair, the SpineZone is an amazing place to straighten out your body. Dr. Ramin Raiszadeh here to tell us about the unique outpatient rehab facility that helps patients avoid surgery, which is really cool, but you're a spine surgeon, so you're encouraging people to come there and not put you out of business, but not have to go under the knife.
Absolutely, Renee. Well, thank you. Yeah, so a lot of our patients who we see every day are non-operative. So if we see 100 patients in a week, 90% of them will get better with non-operative care. And one of the ways that we take them through the non-operative arm is through the SpineZone therapy.
Okay, so explain to me what the SpineZone is. You said it's similar to the concept of physical therapy, but not exactly the same.
It's very unique program in the sense that, so when you go to physical therapy, when you go to the gym and they say, okay, work out your back muscles or work out your abdominal muscles, you have a full range of motion, for example. So if you're moving forward and backwards, there's a 180-degree arc of motion. If you don't stabilize your bottom part of your body, about 110 degrees of that is lost through the hips. So what these machines do is they stabilize your pelvis or stabilize your upper torso, so when you're doing the exercise, you're exclusively strengthening the neck and strengthening the low back.
It's interesting because I know some chiropractors believe, it sounds similar, that you can't just strengthen that one isolated area. You have to strengthen all the muscles around it to support it, because the spine, everything's connected. Absolutely,
absolutely. The key thing is, you know, the key word that we always hear is core, and core, and it entails the whole abdominal muscles, the back muscles, but really strengthening on those small little extensor muscles that we call in the back and the neck that keep you upright and keep you fit.
Well, you guys are located at Alvarado Hospital, and if people get a diagnosis that, you know, hey, you should have surgery on your back, and they say, hey, wait a minute, let me just try this, what is the success rate of people then not having to have surgery?
Oh gosh, if you 80 to 90%, Renee, of patients during their lifetime will have some sort of back pain, neck pain or back pain that requires some sort of treatment. Of those 80 to 90%, about 80 to 90% will get better with non-operative care.
That's amazing.
Oh, that's why the natural history of it is the best thing that favors the patient's overall prognosis.
So basically, I mean, this is an everyday thing to you, but you see miracles like that every day.
Miracles that the body is able to repair on its own, but yet we have a process where it can accelerate the recovery process, accelerate the strength process of your muscle. So that's the beauty of it.
Tell us about some of those machines. I love when you did the, you know, back and front. You know, what are some of the machines you have there?
So one is the lumbar machine, the extension machine, which is one of the key machines, the workhorse, if you will. You get in there, and I wish we had a picture of it, but if you get in there, it stabilizes.
Oh, you're a great model. Go for it.
You stabilize the pelvis, and when you're going, you have a little isometric little band on your back, and you're extending your back. So you're really, when you're doing this, you are doing everything, and all the force goes directly to your back.
You're isolating that
that muscle, so you're not losing anything and dissipating any of the forces through your lower extremity, your upper extremity, just focusing right on the low back.
I think some people may, you know, that are watching may think, you know, but Dr. Raiszadeh, I'm in pain. I don't want to be in more pain doing this.
So a lot of times, this is a great question, a lot of times when you're in pain, what do? You rest. And so you rest, and if you rest and don't do anything with your back or exercise, if you just stay flat in your bed, you're gonna, that muscle in your back will turn into fat. And so what happens is, when you walk, then you start having pain. What our program is, the whole basic philosophy behind it is, you strengthen the muscles, it increases the blood flow. Once you increase the blood flow, it potentially can repair the tissue.
Can this work for children as well as adults and seniors?
Seniors, great. Adults, great. Children, probably not, just because sometimes they won't fit ergonomically into the chair. But children is probably not the best thing. You know, very seldom do I see a pediatric patient with back pain. Usually that has to be explored by the pediatric orthopedic surgeon. But for the capacity of our practice, my practice, it's mainly adult and the older population.
Oh, Dr. Raiszadeh, I am constantly amazed at the unique, high quality, excellent services that you guys here at Alvarado that are just in our backyard.
Yes, it's a very unique program at Alvarado, and they've fashioned at Alvarado to have a spine center. So all we do over there is spine. One of the main niches is spine surgery. So we have a spine floor, private rooms, private nurses, ORs dedicated for spine care. So it's really a very niche product here in San Diego.
All spine all the time.
All the time.
Dr. Raiszadeh, thanks so much for joining us today.
Thank
you. Folks can go to our website and get information on how to come to your place, and hopefully they'll be in that 80 to 90% that doesn't need surgery.
Thank you.
Good to have you on today.
Thank you.